Imagine you ordered a light blue sweater, but you were sent a bright orange one instead. You take it to the store for a refund, but there's a long line and the air conditioning isn't working, so you feel hot and sticky. To make matters worse, the clerk keeps allowing other customers to step in front of you, and you have no idea why. By the time you reach the desk, you're sweating and your head is pounding. You try to explain why you're returning the sweater, but the clerk really doesn't speak much English and just keeps pointing out that there's nothing wrong with the sweater. Now you see how your toddler may feel right before a tantrum or a meltdown. Today, we'll talk about tantrums versus meltdowns and how to address each. We'll also address how to reduce the likelihood that they will occur and how we can be sure that your child will continue to love you through it all. Who am I? I'm a board-certified family physician with over 33 years' experience treating thousands of patients. I'm also a mother and a grandmother, so I have been where you are now. Many moms express a concern that their toddler's tantrums are somehow their fault. They ask if they're doing something wrong in their interactions with their child. And in the vast majority of cases, the answer is no. Your child is simply feeling overwhelmed by situations they have no control over. Something has happened that was not something they wanted or expected, and they can't figure out why. In the example for you, it was being sent the wrong item. In your toddler's life, it may be that breakfast was served on a blue plate instead of the green one. The likelihood of a tantrum or meltdown increases as more and more things occur that they have no control over. In the example, the air conditioner not working made you physically uncomfortable. In your toddler's case, it could be hunger pains or a wet diaper or uncomfortable clothing. Another factor is the perception of unfairness. In the example, you didn't know why other customers were being allowed in front of you when you had been waiting in line and you felt powerless. In your toddler's case, they may see a sibling eating with the plate of their choice and feel that life is unfair. Lastly, in the example, you could not explain yourself well because the clerk spoke very little English. Your toddler also doesn't have a large enough vocabulary or grasp of the English language to be able to adequately explain what's bothering them, and this can be as frustrating to them as it is to you. They had wanted the blue plate all week. Why is it suddenly upsetting to them when you give it to them now? So what is a tantrum and what makes it different from a meltdown? And how can we reduce the likelihood that either will occur? And if they do occur, how can we best address them? In a tantrum, the toddler is trying to get their own way by kicking, screaming, crying, breath holding, or other inappropriate behavior. They're trying to assert some control over a situation in which they feel powerless in order to get what they want. In a meltdown, they've become completely overwhelmed and dysregulated. They are no longer trying to get something they want. They are now simply expressing their frustration and feelings of helplessness by sobbing or throwing themselves on the ground. It's no longer a voluntary action aimed at getting their way, but an involuntary response to feeling completely out of control in a situation. So how do we best treat a tantrum when it occurs? The first thing is to remain calm yourself. The tantrum is a demand for your attention, so you don't want to reward that behavior by giving your child the attention they're demanding. Instead, wait calmly near them until the kicking and screaming have stopped. If they're in a location where they could hurt themselves, you need to calmly and gently move them to a safe location, but don't begin to address their demands until the inappropriate behavior has stopped. They need to realize that their behavior is not going to result in receiving the attention that they're seeking. Some children resort to breath holding to get their way, but you can't respond to that either, or they will quickly learn that if they hold their breath, they can get anything they want. Since you have moved them to a safe location, they should not have access to objects that could physically block their airway, so if they're simply holding their breath, they're not in danger because even if they pass out, they will start breathing again. Once they've calmed down, you can calmly address with them what is wrong and what would have been a better way for them to bring it to your attention. At that point, you can hug them and reassure them that you always love them. But when they're in the throes of a tantrum, you can't change your mind and give in to their demands, as that simply teaches them that throwing a tantrum works to get what they want. You don't want to give them any attention at all during the tantrum because even negative attention is giving them some reward for the unwanted behavior. You stay near them to be sure they're safe, but refrain from commenting at all. Even comments such as, "This is not how you get what you want." Some children intentionally throw tantrums in public spaces such as stores or restaurants because they sense that it's embarrassing to you and that you're more likely to give in to their demands to prevent making a scene. But it's especially important to follow the strategy of remaining calm, moving them to a safe area if needed, and not making any comments about the behavior as that is rewarding it with attention. The time to discuss the tantrum is later, once the tantrum is in the past, not while it's occurring. It's especially important to not make empty threats. I heard a patient in my office once tell her child that if they don't stop crying right now, they're not taking them to Disney World. They put themselves in the impossible situation of leaving their child behind from a family vacation, canceling the vacation entirely, or proving to their child that the parents' words aren't to be believed. By staying calm and quiet yourself, you will be less likely to put yourself in a situation you'll regret. So how do you treat a meltdown? It's initially treated exactly the same as a tantrum. Keep your toddler safe, remain calm, but do not interact with them until the meltdown has ended. When a meltdown has ended, some children will want a hug, but others have been so overstimulated that they don't want to be touched at all. Start with a comment acknowledging that you understand that they were overwhelmed, such as, "Wow, sometimes it's really hard dealing with big feelings. Would you like a hug?" If they don't want a hug, respect that and say something like, "I will give you some space. I always love you and we can talk about this later." Most children will still be dysregulated enough after a meltdown that they really can't even verbalize what caused it in the first place. Let them know that you always love them, but don't expect that they will be able to express at that point that they love you too. They do, but they are still struggling at that point just to get control over their breathing. Of course, it's even better to prevent a tantrum or meltdown when possible. Children need repeated reassurance that you are there for them. If a bit of time has passed since your last interaction, they may act out to receive your attention, as even negative attention is better to them than no attention at all, as it shows they can still affect your emotions and are therefore still important to you. So on a regular basis, give them some direct attention without waiting until they draw it out of you. It could be as simple as saying, "Wow, you're doing such a great job of playing quietly." Or, "That sure is a tall tower. Would you like me to play blocks with you?" Let them overhear you discussing their successes with someone else. It could be a comment like, "Janie used the potty today." This not only emphasizes the good behavior, but also the fact that they are important enough to you to be newsworthy. Times of transition often trigger tantrums or meltdowns. When it's time to leave the house for daycare or preschool, toddlers will often attempt to delay this with a tantrum. Parents then become concerned that perhaps their children aren't happy in the daycare or preschool when it's really the transition that's causing the tantrum, and they actually have a great time during the day playing with their friends and learning new things from their teachers. Toddlers have no concept of time, so even giving them a 5-minute warning doesn't help. Instead, give them some type of countdown. An old-fashioned hourglass-shaped egg timer that counts down 3 minutes can work well, as they can see the sand draining out and they know how much time they have left. A timer on your cell phone that starts with a circle that gets smaller and smaller can also work. Some parents count activities such as 2 more stories and then we'll go, but when it's an activity, the toddlers will find ways to disrupt them to drag the time out, whereas a timer will keep going with a visible reference point. This can be used for almost any type of transition, such as 3 minutes until we get ready for bed, or 3 more minutes on the playground. If they start a tantrum when the time runs out, it's time to remain calm and use the tantrum treatment techniques that we discussed. By giving your toddlers more control over situations, though, they may feel the urge to have a temper tantrum less often. Toddlers are also likely to have tantrums when they're uncomfortable, such as when they're too hot, hungry, overtired, in uncomfortable clothing or in a wet diaper. As much as possible, try to keep them well fed, hydrated, well rested, and in a dry diaper. Try to give them some control over their environment by offering them 2 different types of plates in the morning or 2 different outfits to wear. Although this may not always work, it can dramatically reduce the tantrums that result from your toddler feeling no control at all. Most importantly, remember that through it all, your toddler still loves you as much as you love them. They typically aren't responding to anything that you've done wrong, but are simply trying to gain control over a big world that they don't fully understand. They're testing out the fastest ways to get what they want, and you need to guide them to the understanding that kicking and screaming won't achieve those desired results. Teach them the power of words by expanding their vocabulary to understand the meaning of angry, frustrated, sad, hungry, and tired. You'll help them identify what is wrong so that together you can fix it when possible. And as you teach these techniques to your toddler, you may be surprised to find that they help you as well. And if you find value in this content, please hit subscribe so that you'll be notified when new videos are released.